Hello friends, let us now learn some important points about the evaluation of grid performance. Grids are mainly used to improve the contrast by absorbing the secondary radiation before the secondary radiation reaches the film. Ideal grids should be able to absorb all the secondary radiation but do not absorb any primary radiation. This would give maximum film contrast without an unnecessary increase in patient exposure. But this ideal grid does not exist or never exist. This grid will absorb some, so all the grids, if you say, they absorb some amount of primary radiation. So this is the primary radiation which is absorbed by some of the grids. So the price of a better film is with an increased patient's exposure. So it is absorbing, some of the rays will pass through the grid, so they will get absorbed, whereas they are normal, and sometimes they absorb, some of the primary radiation is absorbed by the grid. So this will increase the patient's exposure. So grids with higher ratios give maximum contrast, but the improved contrast is not necessarily worth with the increased patient's exposure. In every clinical situation, we must outweigh two factors. To help in grid design and grid selection, several tests have been devised to evaluate this grid performance. So there are three different tests which are important for evaluation of the performance of grid. We have primary transmission, which is TP, Bucky factor given by B, and contrast improvement factor by K. So first we will see primary transmission. Primary transmission is the measurement of percentage of primary radiation through the grid. Ideally, a grid should transmit 100% of primary radiation because it carries the radiographic image. This equipment, the how to measure this primary radiation is very important. So how to measure this primary transmission? So for measuring a primary transmission, this is the target anode. The X-ray beam is collimated to a narrow pencil thin beam of radiation, and it is passed through the phantom of water. Right. So narrow thin pencil beam of radiation is passed through a phantom of water, and this phantom is placed at a greater distance from the grid. So this is grid. With this arrangement, we can make sure that whenever the radiation is scattered here, it will not reach the grid. So this is the pencil thin X-ray beam. This is the water phantom. So these are the scattered radiation which are produced. So there is one more lead diaphragm which is placed here. So because of this lead diaphragm, no scattered radiation could reach the grid. A small amount of scatter which is produced in the phantom, it diffuses out of the beam because of the large air gap present between the phantom and the grid. And it can also decreases by placing a lead diaphragm also. Now, there are two measurements which we take here. One, we determine the percentage of primary transmission. So the first measurement is made with the grid in place. By placing the grid in place, we measure or we determine the intensity of radiation transmitted through the grid, and the second measurement is made after removal of the grid to determine the intensity of radiation directed at the grid after removal of the grid. So this primary transmission is a simple ratio of intensity of radiation transmitted through the grid divided by the intensity of radiation transmitted after removal of grid, that is without the grid. This is called as TP or primary transmission. So primary transmission is given by intensity of radiation with grid and without divided by intensity of radiation without grid into 100. So here we can draw a table which is determining the primary transmission. So this is the grid ratio, grid number, grid ratio, lead strip thickness, interspace thickness and primary transmission. So this uh, table shows the primary transmission for 8 different grids. There is significant loss of primary radiation is seen with these grids. For these 8 grids which is tested, so so for these 8 grids which is tested, we can see that the primary transmission varied from 57, which is the least, to 72.5 as the grid number or grid ratio increases. So the primary transmission is generally lower for crossed grids. These two are the crossed grids with 2 dimensions. These are linear grids. So if you see for crossed grids, the grid number is very less. See, this is 57. Here the grid, the primary transmission, sorry, for crossed grids, the primary transmission is lower when compared to normal linear grid. So the primary transmission as measured experimentally is less than the anticipated transmission, primary radiation. So primary transmission which is measured experimentally is less than would be anticipated. If the geometric relationship between the X-ray strips and the X-ray target is accurate, there is no grid cutoff and all the primary radiation passes through the lead strips, then the percentage of the grid surface area is made up of interspaces with the percentage of will be the percentage of anticipated primary radiation. So, in anticipated primary radiation, if geometric relationship between the lead strips and the X-ray target is accurate, there is no grid cutoff. So, and no grid cutoff meaning that no primary radiation is absorbed in the interspaces. Then so no primary absorption is absorbed in the interspaces. Then this primary absorption passes through the grid. So percentage of anticipated or percentage of grid surface area in interspaces is equal to percentage of anticipated primary radiation. So if there is no grid cutoff and no primary radiation in the interspaces, then percentage of grid surface area in the interspaces is approximately equal to percentage of anticipated primary radiation. So this can be given by calculated anticipated primary radiation is equal to the thickness of the lead strips and thickness of interspaces. First, interspace thickness by interspace plus lead strip thickness. So calculated anticipated primary radiation is given by the formula interspace thickness divided by the interspace plus lead strip thickness into 100. So this anticipated primary radiation is more when compared to the experimentally calculated primary radiation. This is experimentally calculated primary radiation, which is many times lesser when compared to this anticipated primary radiation. So let us take an example. So in an example, if the thickness, interspace thickness is equal to 390 micrometers. See, just take an example. This is seen in this figure. Yes, in this figure, if you see for a 15:1 grid, for this grid, the anticipated primary radiation is 64%. So let us take an example where the lead strips are around the lead strips are 60 microns in thick and the interspaces are around 390 microns in wide. Now, if you calculate the anticipated primary radiation, it is around 87%, whereas in the diagram given here, the anticipated primary radiation for this 15:1 grid cutoff is 64. The experimental primary radiation for a grid ratio of 15:1 is 64%. The experimental primary radiation for a grid ratio of 15:1 is 64%. But the anticipated primary radiation is around 87%. So there is a difference in this is around 23%. That is the calculated primary transmission or the experimental primary transmission is lesser when compared to the anticipated primary transmission. Experimental or measured primary transmission is lesser than the calculated or anticipated primary transmission. This difference is largely because some of the absorption of primary radiation is done by the interspace material. Also, there is some loss of primary radiation because of mechanical imperfections. So, the difference is around 23%. This 23% is mostly absorbed by the interspace material. Also, there is some loss in the primary radiation is seen due to the imperfections in the focusing of the lead strips. Then the next parameter for evaluation of the grid performance is the Bucky factor. So, Bucky factor is the ratio of incident radiation falling on the grid to the transmitted radiation passing through the grid. So, ratio of incident radiation falling on the grid to the transmitted radiation passing through the grid is Bucky factor. This Bucky factor indicates how much we must increase the exposure factors. It indicates the amount of radiation that is absorbed by the grid, either primary or secondary radiation. So, it will also increase the exposure factors of the patient. So, it indicates how much increase in exposure factor of the patient when we change from non-grid to grid technique. It also tells us about how much patient exposure dose is increased by the use of the grid. So, Bucky factor is almost similar to the primary radiation except that there is one difference. Primary radiation mainly or primary transmission, it is similar to primary transmission except that there is one difference. Primary transmission indicates mainly the amount of primary radiation absorbed by the grid, whereas Bucky factor indicates the absorption of both primary and secondary radiation. So, this Bucky factor is determined with a larger X-ray field and a thicker phantom. So, thicker water phantom is used and the X-ray field is also larger. It is not collimated. So, the transmitted radiation is measured by using the grid in place and the incident radiation is measured after the grid is removed. So, Bucky factor is the transmitted radiation, that is the radiation or primary radiation which has transmitted through the water phantom through the grid and it is detected by the X-ray detector. So, this transmitted radiation is measured by keeping the grid in placing the grid in place and then you remove the grid. After removal of the grid we measure the incident radiation, that is without the grid. So, Bucky factor is equal to the incident radiation which is measured by removal of the grid by transmitted radiation which is measured with the grid. So, this Bucky factor is a measure of total quantity of radiation absorbed by the X-ray beam absorbed from the X-ray beam by the grid. So, Bucky factor is the measure of total quantity of radiation absorbed from the X-ray beam by the grid. So, it is also the grid's ability to measure the scattered radiation. So, this is the grid ratio at two different KVPs, that is at higher and lower KVPs. That is, this table shows the Bucky factor for different grids with two different energies of radiation. If you see, the higher ratio grids absorb more scatter and have larger Bucky factors. Higher ratio grids will absorb more scatter radiation and thus they have larger Bucky factors. Thus, so they have larger Bucky factor. So the size of the as the grid ratio increases, the Bucky factor will increase. One more important thing is the Bucky factor is also dependent on the energies of the X-ray beam. Size of the Bucky factor depends on the energy of the X-ray beam. So the high energy beams generate more scatter radiation, and thus they place a greater demand on grid's performance than low energy beam. So if this is the high energy beam, this high energy beam will produce more scatter radiation. So as a result, it requires more grid ratio or more Bucky factors for the higher energy beam to get absorbed. So here Bucky factor of 16:1 grid in this table increases from 4.5 at 70 kVp to 6 at 120 kVp as the radiation energy increases to 70 and 120 kVp. So by more scatter is generated by this 120 kVp, and this more scatter generated by 120 kVp is successfully absorbed by 16:1 grid. Whereas the 5:1 grid is not sufficient to absorb it. So higher grid ratios absorb scatter radiation better for higher energy beams. So Bucky factor increases with increase in X-ray energy also. So as X-ray energy increases, Bucky factor also increases. So for low ratio grids, Bucky factor will not increase with increase in X-ray energy. Why? Because if you see in this picture, the the 120 kVp X-ray energy X-ray beam produces more energy, more scatter radiation. So this more scatter radiation requires more ratio grids to get absorbed. Whereas if you see the lower ratios, that is 5:1 ratio, has almost same Bucky factor for both 70 kVp and 120 kVp. So Bucky factor is same for a 5:1 grid for both 70 kVp and 120 kVp radiation. Thus low ratio grids do not absorb the scatter radiation uh, from high energy beams, as well as high ratio grids can absorb scatter radiation for high energy beams, whereas low ratio grids do not absorb scatter radiation from from high energy beams. Then, although high Bucky factor is desirable, there are some disadvantages. Higher the Bucky factor, greater is the absorption of scatter radiation. So this scatter radiation and also primary radiation. Greater is the absorption of scatter and primary radiation. This will increase the exposure factors to the patient and thus increases the radiation dose to the patient. So if the Bucky factor Bucky factor is very important uh, for the radiation dose or for maintaining the radiation dose to the patient. The next parameter for evaluating the performance is contrast improvement factor given by the letter K. It is the ratio of contrast with a grid divided by contrast without the grid. So this is the ultimate test for grid's performance, because this contrast improvement factor is a measure of grid's ability to improve the contrast, which is its primary function. Unfortunately, this contrast improvement factor depends on kilovoltage peak, field size and phantom thickness. This is understandable because these three factors determine the amount of scatter radiation. So, larger the quantity of scatter radiation, more the scatter, poorer is the contrast. So, thus lower is the contrast improvement factor. To permit the comparison between different grids, we have this ratio, this table, and to permit the comparison between different grids, the contrast improvement factor is usually determined at 100 kVp. So this is measured at 100 kVp. So the contrast improvement factor is measured or determined at 100 kVp with a large field and a phantom of around 20 centimeters thick. So uh, this parameter is mainly recommended by the International Commission on Radiological Units and Measurements. So this is the table which we got by the similar measurement. So here we used 8 different grids and the contrast improvement factor, lead content and grid ratio of all the 8 grids is given. If we observe this carefully, the if we observe this carefully, we can see that this contrast improvement factor and the lead content are a little related, because as the grid number increases, the lead content will also increase and the contrast improvement factor also increases. So, contrast improvement factor is closely related to the grid content, lead content of the grid. Generally, higher the grid ratio, higher is the contrast improvement factor. But this grid ratio is not as reliable as an indicator has lead content. So, lead content is more reliable indicator than the grid ratio. So, if you see the kVp, kilovoltage peak, field size and part thickness or phantom thickness are the ones which determine the scatter radiation. Although contrast improvement factor of a grid depends on these three techniques, the kVp, field size and part thickness, relative quality of the two grids appear to be independent of these three factors, that is kVp, field size and part thickness. So, we have learned about the all three factors of uh, evaluating the performance of grid. Thank you.